Hello, Dr. Connor here again. I hope you saw my video in Dr. Anderson's course. And I just want to say I'm sure you're very excited about wrapping up your second semester. So this very brief video that will be posted in Mrs. Miller's course is just for me to give you a little bit of information about what to be prepared for as you start the summer course, particularly the course I'll be coordinating, which is NURSU 428, and that's your practicum course. So the first thing to know about the course is there's really very little in terms of didactic content. What we do and what I do is give you videos like this and a lot of information about how to develop a really solid evidence-based practice quality improvement project proposal. Hopefully, I believe I said this before, some of you will be able to actually implement a project. You may be already in the process in your unit of something being ready to be done. But we know that the summer is very short. We have about 12, maybe 13 weeks, and we know it's very difficult to actually develop, implement, and collect data pre and post implementation and finish a project. So we don't really expect completed projects. If you know that you can do that, then your faculty will work with you and will be very excited about that. But otherwise, the purpose of your capstone course is to really learn the process of developing an evidence-based practice quality improvement project. So to that end, I really hope that through developing PICO questions and doing some literature review in Dr. Anderson's course, you have come to some decisions, have an idea about what kind of a project you would like to do. Some of you may be totally on course with that. Some of you may have done something for his course and then maybe that's not going to work. That's okay. It's quite all right. But just to let you know that as soon as we hit the ground running on May 9th, the summer will start, our course will start. It will be very important for you to identify your PICO question that helped. What a PICO question does is help you guide your literature review to find some background information on your clinical issues. So we really hope that if you're using the PICO question and you found some background in Dr. Anderson's course, that's going to make it much easier for you. But if you didn't, or if you're doing something different now, that's fine too. We just want you to know that. But you will really have to work hard in the first couple of weeks to sort of make sure that you have an idea of what kind of a project you would like to work on. More than likely, this needs to be something on your unit, or your area that you work in, wherever that may be. Most of it for you all is probably acute care hospitals, but some of you could be in home health or some other areas, so we understand that. Wherever you are, it's really vital that you connect with your manager, director, some doctors, hopefully nurse practitioners, and perhaps certainly QI people, quality improvement people, infection control people, patient safety people, people like that who can help you decide that, what is a clinical issue that really needs to be done in your area. That's the key. It's not really just a broad sort of idea. We know that falls are a problem in most hospitals. So, one could say, well, I want to look at falls as an issue and try to create a quality improvement project around that. However, if it's not an issue or a problem where you're actually working and where you think the site that you want to try to propose this for is going to be, then excuse me, then that's not a good thing. So we just want you to be able to identify a problem that is a local problem in your area, where you work, or something that's certainly very accessible to you. It doesn't always have to be exactly the unit you're working on right now, but it has to be someplace that you have access to data. What we want more than anything through the summer is for you to propose a project, and it's not just hypothetical. I mean, it's a project that could be done in your area that you can gain some pre-intervention data. That's what we call data that you gather that is before anything is done. Here's what the current situation is. So you'll learn more about that as the course starts. So I just am giving you a heads up now that it's key to find out what you may think is a problem. You have to have some data to back that up. You have to have some measure, some way of saying that we know this is a problem in this area, and that's why we're going to address it here. So that's sort of a key thing. Next thing to really begin thinking about, and I'm going to make this very brief, but I just want you to think about these things prior to the course starting on May 9th. This is a team approach. You are going to be the team leader, in essence, as you develop a project proposal, but we want you to have a team of people that you talk to. We want you to identify, hopefully, a provider, a doctor, a PA, a nurse practitioner, somebody, or even a couple of those if possible, but more than just nurses, because unfortunately what we know, and I know as being a nurse for 33 years, we can't always do everything. We often have to follow physician orders, nurse practitioner orders, things that happen, so we can't do everything ourselves. That's why a team approach is so important, and it's important for you to identify who would be the team members that would be most important for you to have on your team according to what type of project you want to work on. Who are the people? And it may be QI people, hopefully. It may be infection control people. It may be risk management people. It may be your manager. It may be a nurse educator. Whoever it may be, there are people aside from just nurses who need to be on your team. And the whole idea of, as we go into this practicum for you in the summer, is that you're the team leader. So part of what you're doing is developing an evidence-based practice quality improvement project proposal that we can propose. And if you can get it done, that's great, but we don't expect that totally. But the other key is that you are a leader. One of the keys to in the RN to BSN program, one of the things we want you to leave with as you graduate and become a BSN, have a baccalaureate in science in nursing, we want you to know that you have to become a leader. You're not just a nurse working on a floor, taking orders. You're a leader, and you are one who will aspire to leadership roles. And so leading a team, particularly around evidence-based practice and quality improvement, is vital. So those are sort of the really important keys that we want you to get out of the course this summer. The summer will go really fast, believe me. That's why I'm trying to give you another heads up here. We gave you a little bit of a heads up in Dr. Anderson's course about what NURSU 428 is going to be like, and now I'm trying to give you another little bit of a heads up that once we start, I mean, it's not like you have 2 or 3 or 4 weeks to sort of figure out what's going on. You've got to know really quickly what your plan is, how you're going to go about it, who's your team going to be, and start pulling those things together very quickly. Now the good news is there are 51, 52, something like that, students that will be in this course. We have 5 faculty that are going to be in this course. So I'm the course coordinator, and I'll have a group probably of 10 or 12, but we have 4 other faculty then who will be having small groups. So you hopefully will be in a group of about 10 or 11 students working with one faculty member, and Mrs. Miller will be one of those faculty members, along with several of our other key faculty here at the MUSC College of Nursing. And these are people who are really informed about quality improvement, evidence-based practice. They know how to guide you through developing your project. So having this smaller number, so what we call a ratio, say 1 to 10, 1 to 11 ratio of faculty to students, will really help you and help the faculty, as they can help guide you very closely with each of your projects. As the course coordinator, I couldn't possibly deal with 50-some students and projects that they're developing. So that's why it's wonderful that we have these extra faculty in the course and these small groups who can help guide you through your project proposal process, and hopefully maybe for some of you even in the process of completing a project. So as we get to the end of the course in the summer and just before you graduate, our hope is that we have a few projects that really get completed. That'll be marvelous, but we hope we have some excellent project proposals that hopefully will get done even after you graduate. We recognize you have a short time period in this course and you probably will not be able to complete projects, but we want you to develop things that you can complete after you graduate, because this is not just about a course to help you get your degree. It's really about a course to help you learn how to improve patient outcomes. So thanks for listening, and I look forward to seeing you beginning May 9th.